Hi everyone, good afternoon. My name is Pavan Patel. I'm a local resident here of Fayetteville and Cumberland County, small business owner, and today I'm representing the Millennial Advisory Commission here with Dr. Green, the health director of the Public Health Department here for Cumberland County. And we just wanted to kind of debunk some COVID myths and vaccination myths for y'all and get some expert knowledge out there.
Thanks, Pavan. I appreciate you having me on today.
Thank you so much for your time. So Dr. Green, over the last year and a half, pretty much everyone around the globe's heard about COVID-19, but now we're looking at, this Delta variant, and just wanted to know from your perspective, your expert knowledge, what's the difference from COVID from the first initial days of the pandemic to what we're dealing with now?
Yeah, that's a really great question. So I think a couple of key differences stand out for me. One, we know a lot more about COVID than we did a year ago, than we knew about 18 months ago. We know more about how it's transmitted, which is primarily through respiratory droplets. Of course, the big difference is we have vaccines now. So we have vaccines that are life-saving, that are safe, that are effective, that help individuals stay out of the hospital, help individuals not pass away due to COVID. So that's a world of difference than when we started this. We also know more about mask wearing, and that masks really are a really important strategy and effective to helping us to slow down the spread of COVID. So while the numbers feel very similar to where we were last year, we actually, I think, are in a much better position to combat COVID than we were last year. We just need to implement those strategies.
Speaking towards strategies, you mentioned vaccinations. There's multiple vaccines on the market for, our community at large. What's the difference between, these mRNA vaccines versus the traditional vaccines and the booster shots that are coming up? And what would you recommend for those whom are unvaccinated and those who are vaccinated?
So the first two are what you said, mRNA vaccines, and that's Pfizer and Mrna, and those vaccines work by sort of teaching our body how to fight COVID without actually infecting us with COVID. And so both of those are 2 doses. Pfizer, you take 21 days apart, Mrna is 28 days apart, and you are fully vaccinated 2 weeks after your second dose. The traditional kind of vaccine that we think about is J&J, or Johnson & Johnson, or Janssen & Janssen, and that's a single dose shot. So if you are a little squeamish on the needles, that might be the dose for you. All of these are safe and effective vaccines. All of them have been reviewed by the FDA, and they have varying levels of effectiveness, but by and large hold up very well against the Delta variant, are especially for hospitalizations and for severe illness and passing away due to COVID. We want people to continue to wear their mask because we're talking more about layering levels of protection. So one level of protection is to wear your mask. And because that Delta variant is so contagious, more than twice as contagious as these other variants that we've had for COVID, we want you to wear your mask when you're inside. So that's why, of course, we're wearing our mask right now. And we want you to do that even if you're fully vaccinated, because we just want to make sure you have that extra boost of protection. We want to layer that with vaccination. So even with these indoor mask mandates coming around the country and around our state, we still want you to get vaccinated because, again, we want to layer that level of protection. It's also important, the masking, because our kids are not eligible. Many of them under 12 are not eligible. So we want to make sure that we're protecting our little ones from getting COVID as well. So putting those two things together, masking plus COVID vaccines, really strengthens our ability to fight against this pandemic. Everybody, I think, has to get their own reason. I wear my mask because I have a 4-year-old at home who is too little to be vaccinated, and I want to make sure that I'm protecting myself so I can protect him. Somebody might have an immune-compromised grandma or parent or themselves, and we want to make sure that we are giving you as the individual and us as a community the best chance that we have to not get COVID and not to pass away or die. And so by doing those little things, that really helps to slow down the spread. So I think that personal reason everybody wants to wear a mask, besides you're required to, it really has to be to protect yourself and then the health of others around you.
Makes complete sense. I think it's a great precautionary, thing that everyone can take a step to help, their communities, their families. So hopefully we'll go that route. And kind of jumping from there, from a vaccination standpoint, what are a lot of, besides just wearing masks, for example, there are a lot of questions out there about COVID, about the Delta variant, about mask mandates, and definitely about vaccines. Are there any public opportunities as far as, hotlines, websites that you would recommend for anyone that has questions, that would like to reach out from a medical perspective, or, questions about the vaccine?
Yeah, so there's a lot of great resources, and what we'd urge the public to do, especially our young people, regardless of where you look, please make sure that is a credible source of information. So we hear a lot of misinformation, and so a couple of those places that are great local resources are your county health department website. So that's Cumberland County nc.gov, so that's one. Our state health department has a wonderful website with information with our current COVID status, our vaccination rates, but also guidance for testing, guidance for how to get your vaccine. And so you can go to covid19.ncdhhs.gov. The CDC website is a great resource, and they also have a vaccine finder at vaccines.gov. So lots of really cool resources that are where you could probably spend hours looking up information about vaccines. And we just urge the public to make sure that as you're looking for those sources, making sure that they're really strong and credible resources.
So Dr. Green, just to kind of wrap up our session here, if you had one-liner to say basically to our community and our individuals here, what would it be?
Get vaccinated. And the thing I'll say about that is don't wait to get vaccinated. We need you to take action to do that today, tomorrow. And if you've been vaccinated, we need you to pull in a friend, a family member who hasn't been vaccinated, and bring them with you. We are seeing is that younger and younger people are getting hospitalized. Our older adults, 85+% of them have been vaccinated here in our community. So the number of them getting hospitalized and dying, it still happens, but is dropping. And we're seeing 20-year-olds, 30s, in their 40s passing away or getting hospitalized due to COVID. And we want to make sure that we're protecting you and keeping you safe. So getting vaccinated is our way and our path forward. And then I got to say that, for the folks that are thinking, well, I'm not going to get hospitalized, like I'm going to have a mild case of COVID. I hope that, one, you don't get COVID. Two, if you do get COVID, it's a mild case. But the other thing we're concerned about is if all of our hospital beds are filled with COVID patients, and you get in a car accident, or you break an arm, or you have some severe illness that you need to go to the hospital for, we want to have a bed for you. And if they're all filled with COVID patients, then we won't be able to have a bed to keep you safe for other health conditions. So that was much more than one line, but my piece, we really, the path and the way forward to taking off our masks, to getting back to normal, to stop hearing from me talk, is to get people vaccinated. What
we've learned today is it's going to take every individual in the community to make the difference. It's not, one person can't change this.
No, you're absolutely right. Like, this is, I always tell our team, public health is a team sport, right? I can't do it, you can't do it. We have to have our community members rally together to get vaccinated in order to move us forward.
So again, everyone, I hope today's interview with Dr. Green was informative. As she said, look for any questions you may have, get the right answers, and go get vaccinated. Take your step, do your part to make sure our communities move in the right direction. Again, Dr. Green, I want to thank you so much for your time and your input. I know you're an expert in this field, so everyone, please, this is a credible source. Listen, this can really make a game-changing difference for our community, and appreciate your time.
Thank you. I appreciate it. Thank you for having me on.
Hello everyone, my name is Kayla. I am the chair of the Millennial Advisory Commission, and I am here today with Dr. Fuller. We are here at the Cumberland County Health Department, and today we're going to be talking a little bit about the COVID vaccine and its effect on children as well as expecting families.
Hello, my name is Dr. Tarika Fuller. I am a family nurse practitioner. I currently work at the Cumberland County Department of Public Health. I work in the Family Planning Clinic, which is our women's health, also in our communicable disease clinic and the child health clinic.
Thank you so much for taking the time today, Dr. Fuller. So I'd like to address this just by opening up with a general question around fertility and the vaccine. Can you tell us a little bit about the vaccine's effects on fertility, if there are any?
Great question. There are no found effects of infertility following the COVID vaccine. Research has been done, and of course they have been found that there are pregnant women following the COVID vaccine, following the first dose of the COVID vaccine. So there are no found evidence that you cannot become pregnant following a COVID vaccine.
What about long-term effects on the baby? Have we seen any birth defects, any later comorbidities, whatever that looks like? Have there been any effects on the baby?
No evidence. No evidence. Research, the COVID vaccine has been well researched and well studied prior to it becoming on the market and prior to us obtaining the vaccine, and there has been no evidence that infertility or any birth defects have been seen following a COVID vaccine.
Should they be getting the COVID vaccine as a pregnant woman?
It is very much recommended that those who are pregnant to obtain the COVID vaccine. We have seen multiple pregnant women in the hospital very seriously sick following admissions into the hospital with COVID. Oftentimes needing ICU admissions, needing extra oxygen help with intubations. So it is very much recommended that pregnant women receive a COVID vaccine.
What about if a pregnant woman were to get COVID without being vaccinated? What are some of those effects?
We have seen worst case scenarios that babies have died following positive moms with COVID. So if there's any way that we can stop that from happening, which is infant mortality, yes, we would definitely recommend that women receive the COVID vaccine.
And let's talk about now the COVID vaccine is approved for children. So can you tell us a little bit about what that looks like now that it's approved for children?
What we do know is that children are beginning to fill our hospitals with COVID. So we do know that. So if there's any way that we can stop that from happening, which is by using the COVID vaccine and receiving the COVID vaccine, we would strongly encourage that 12 and over children should receive the COVID vaccine. The admission rate of children with COVID is very alarming. And we know that the COVID vaccine will help with the fight of COVID. So we strongly recommend, if you have a child 12 and older, to receive the COVID vaccine. Evidence has shown us that there is no evidence that the COVID vaccine has caused any longing effects on children or adults.
What if my child is not 12 years old yet? How can I protect them from COVID?
As a parent, you can definitely obtain the COVID vaccine. If you're age appropriate, of course. And we can also encourage those who the children will be around to also obtain the COVID vaccine. In regards to the child, you can definitely strongly encourage them to continue to wear their mask, washing their hands, using hand sanitizer, and using social distancing.
Do we feel it's safe for children to be in school? How can I kind of mitigate some of that risk?
Yes, I know that the numbers are alarming within the schools, but it continues right now to be safe for the children to continue to go to school. But once again, we do strongly encourage that the children, those who are 12 and older, to receive the COVID vaccine and begin to, use hand washing and socially distancing. But right now, we do not see that it's any reason to be alarmed or that children should stop going to school.
Now I'd like to kind of talk to you about addressing people that have concerns with the vaccine. I represent the generation where I think a lot of us feel we're invincible, we're young, if we get sick, we'll get over it. So what are some things that you've been telling patients that maybe come in with that mindset that we can take and share with our peers?
the concern with COVID is the mutation of COVID. And currently we are dealing with the Delta, okay, which is the Delta variant. That is very concerning because it is causing more effects than the previous COVID that we dealt with in 2020. So people are becoming to be much more sicker with COVID. Now, we thought that those who do not have any type of comorbidities will probably be able to fight COVID, but that is not being the case. So therefore, we are strongly encouraging those who can to definitely get the COVID vaccine to build antibodies against COVID. No vaccine is 100%, but we know for sure that this COVID will assist with healing and healing from COVID or recovering from COVID, and oftentimes not having the lasting effects than those who are actually dying from COVID. The unvaccinated are dying from COVID.
I think one thing that's holding a lot of people back from getting vaccinated is the misinformation, disinformation, abundance or lack thereof of information. So what advice do you have for people as they seek out this information to make an informed decision?
Right now, I would say always check your CDC website. And if you don't feel comfortable or you don't understand that information, you can always reach out to your local health department or your local primary care provider.
Is there any advice or other information that we should be aware of, either as younger adults or adults who have families or looking to start families in the near future?
We do know that the COVID vaccine has helped. We are much further than we were. I know that the numbers can be alarming, but we are seeing that people are recovering from COVID following the COVID vaccine. We are seeing that evidence has shown us that it has not interfered with infertility or birth defects. We are seeing families get back together following the COVID vaccine, and we do know that the evidence has shown us that the hospitals are filled with COVID right now. Our numbers are going up. And we also know that those who are unvaccinated are dying from COVID. So I strongly encourage that you consider a COVID vaccine and obtain a COVID vaccine.
Hello everyone, I'm Pavan Patel with the Fayetteville Millennial Advisory Commission, and we're here to debunk some more COVID myths about the virus and the vaccine. And today joining us is Dr. Neeti Kapoor with Devoted Family Practice here in Fayetteville. Thank you for your time, Dr. Kapoor.
It's my pleasure to be here with you.
So Dr. Kapoor, we polled our community for questions concerning COVID-19 and the vaccination, and a lot of folks have some vaccine hesitancy. There's some myths that I think still might be able to be debunked about the virus, and we're hoping you might be able to help us out today. So one of the big things for younger folks we found is, well, if I'm healthy, what's the big concern about the virus versus the uncertainty of the vaccine?
That's a great question, Bhavin, and one that I get in the clinic a lot with people who are debating whether or not they should be getting the vaccine. So people in their 20s, 30s, and 40s have caught COVID, and although there's less of a likelihood of them being hospitalized from it or dying from it, there is a chance that they can end up with serious complications. One of those complications is long-haul COVID. It's a condition where symptoms will last beyond 12 weeks. And those symptoms can be fatigue, they can be breathing issues like shortness of breath, they can be cognitive impairments that last a much longer period of time. So although the serious effects that lead them to hospitalization may not occur as often, there are long-term effects that can definitely have an impact. I'd also like to say that in the US, there's been about 10,000 deaths in people younger than the age of 40 because of COVID. So even though folks are young and healthy, it's the individual's immune system and how it reacts. And so there's no guarantee, just because you are young and healthy, that you might not also suffer the serious complications.
If I get the vaccine, I should be protected against COVID, but there have been cases where folks with the vaccination still catch COVID and get sick. So what's the point overall?
So people who are vaccinated in general just end up requiring less hospitalization, and there's a much lower risk of death in those people. The vaccine is highly effective. It's about 90 to 95% effective in the vaccines that we have the option to get. The influenza vaccine, which we give every year, it's about 40 to 60% effective. So if you look at flu versus the COVID vaccine, we have a much effective immune response when it comes to the COVID vaccine that is now being offered. The other thing is that the COVID vaccine being efficacious, it doesn't only target one piece of the immune response, which is the antibodies. We're looking at helper B cells, we're looking at T cells, and we're looking at other forms of the immune response that really help to give the immune system a vigorous way of fighting the infection once it sees it, once the person has been vaccinated. When you get the COVID vaccine, the body goes through a trial run. The immune system sees that spike protein in the vaccine and it generates an immune response to it. When you get the initial vaccine, that immune response is about 50%, depending upon which vaccine you get. And when you get the second dose, it goes up to about 90 or 95%. So at the first dose, you may have some arm soreness, you may feel a little fatigued because that's your 50% immunity there. You may not have any symptoms at all. And with the second dose, sometimes the symptoms are a little bit more rigorous. Again, it's your body going through that rehearsal of getting the infection. And so you might have some fevers or aches or chills or muscle pains, but those should also resolve. And if you get the COVID infection after that, the whole point of the vaccine is really to mitigate the severe response that you would have to an infection after a vaccination, which is why we give the vaccines. And it has definitely shown that it will reduce the rate of hospitalization with severe symptoms as well as death if you've got even at least one jab of that COVID vaccine.
We've heard a lot about COVID and the vaccines that have come out, and especially the new mRNA vaccine versus what we typically consider traditional vaccines. How does that differ, and what's the safety surrounding that new mRNA technology?
I had a lot of those questions when the COVID vaccine was first put to market. I wanted to know how they could get the vaccine out so fast, and I had a lot of those same questions. mRNA technology has been around for a while. The SARS virus, which came and it caused an epidemic as well, not as much as COVID, but it has a lot of similarity in terms of its DNA structure to COVID. So research was being done on years for SARS. When at the end of 2019, we found out about COVID, and early in 2020, when the whole genetic sequence was mapped, they found out that there was an 80% overlap to SARS. And so that research was already done. They knew that they had to target the spike protein to make the vaccine, and making the vaccine, which usually takes a while because of the red tape involved bureaucratically and also the funding, that's what kind of takes the longest. Those things were taken away. The funding was given and the red tape was taken away. So then the research which had already been done could be put to use quickly because there was so much similarity between previous research and then the coronavirus, that was overlapping, that it didn't take very long to get this to market and have it become available. So the numbers come down to, for the J&J vaccine, there were reported 7 cases out of about 1 million for thrombosis or thrombocytopenia, which is clotting issues. And again, that's 7 cases out of about 1 million. And for myocarditis, which is an inflammation of the heart muscle, those cases were reported more for the mRNA vaccines. Pfizer and Moderna, and those cases are less than 1%.
If I've already been sick with COVID or if I have COVID, should I still get the vaccine? And is there any additional protection, or would I just be naturally immune?
If you've been sick with COVID, the research has shown that the immunity starts to wane, which means that it starts to decrease at about the 3-month mark. And at the 10-month mark, after you've had the COVID-19 infection, at the 10-month mark, it's almost diminished down to 0. So it's important, or I would say advisable, to get the vaccine, because the vaccine can give you longer protection, and it can, from what we know right now, give us protection against the variants of COVID. Delta variant being the most known right now because it is the most infectious. There are other variants there. We have alpha and beta variants, and from what we know, the vaccine is effective against those as well. So again, even if you've had the infection, the immunity will wane at some point. The vaccine will give you better immunity and also immunity to the variants. I wouldn't advise getting it if you're sick with COVID symptoms. I would wait until you get better, and then I would think about getting that first dose.
We've seen mask mandates and social distancing still stay in place for vaccinated folks. Why is that still there, and is it effective?
So a study published in the Journal of Nature Communications, June of 2021, that examined the association of community-level social distancing measures and individual face mask wearing. And it was a large prospective cohort study that was done in the US, and it studied about 198,000 people, all right? It said that individuals living in communities with the greatest social distancing had a 31% lower risk of COVID compared to those living in communities with poor social distancing. Self-reported mask use also was associated with 62% reduced risk of predicted COVID among individuals living in a community who maybe weren't distancing as much. So again, 62% reduction in COVID transmission, even if there's not a lot of distancing going on in that community. The Mayo Clinic also engineered a study to put the effectiveness of masks and social distancing from a practical standpoint. And they looked kind of at the interaction in the workplace and people eating lunch together and how that looked like. And they used 2 mannequins, and they distanced them at 1 foot, 3 foot, and 6 foot. And they had masked either one of them, both of them, or neither of them. And then they measured aerosolized particles in the study. So what they found was that when the COVID positive mannequin is masked, there's a 99% reduction in the number of droplets that are put out into the air and reach the other person who is unmasked, even at 1 foot. All right? And they also found that when the person wearing the mask who doesn't have COVID is in close contact with a person who has COVID who is unmasked, then there's about 60% reduction at 1 foot. Okay, so the unmasked person has COVID, the masked person does not have COVID, they're within a 1 foot distance of each other, and there's a 60% reduction in particle transmission. Now, this reduction gets bigger and bigger the more you distance. So it looks like there's definitive evidence for both social distancing as well as masking when it comes to a benefit for transmission.
So if there's one last piece of advice for you to share with the community, what would it be?
COVID has brought about a new situation, not only for the community, but for doctors as well. This is not something that we've seen. This is not something that we are going to have all the answers to right now, but understand that we are doing our best. We're trying to get the information gathered. We're trying to look at it very objectively, and we're trying to give out the best advice and the best guidance that we know how. It's not easy for anybody to stay away from family or to put on masks or to keep distance, but it is, in terms of studies and even in terms of just practically seeing, even in the clinic, it's made a big difference. And so it's simply about doing our best to keep everybody safe, even if that means doing something that for the time being you might not be totally in agreement with or totally comfortable with. It's not going to do harm to you. It might not be what you totally agree with, but again, we're looking at a big community picture, and we're all just trying to do our part.
Again, thank you, Doc. We really appreciate the time and all the information and guidance you provided. And hopefully everyone take her last statement at home. It's really, what we can do as a community, and everyone has their part to play. So thank you again, and stay safe, Fayetteville.